Morning, everyone. Thank you for joining me here today. I want to begin by offering my deepest condolences to those who've lost a loved one because of COVID. The recent surge in positive COVID cases in the Winnipeg region is obviously a concern to everyone, and we are doing everything we can to help limit the spread of this virus and to protect our most vulnerable Manitobans. And that is job one. This year has been like no other. COVID-19 has handed us all new challenges, even greater ones than before, and we've had many of them here in Manitoba. COVID nous a lancé de nouveaux défis et des défis encore plus grands qu'auparavant. Yet this year has also shown Manitobans at their finest. Manitobans have made personal and professional sacrifices. You've gone above and beyond to protect yourselves, your loved ones, your community, and your province, and that must continue now, and with even more enthusiasm than before. We recognize the significant challenges that Manitobans have faced, which is why we've developed some of the most generous support programs in the country to help you navigate through this unprecedented time. Our Manitoba Gap Protection Program has provided now almost 10,000 small businesses with supports, with applications continuing to flow in on a weekly basis, and we expect that to continue and to grow as we win this battle against COVID and our business community begins to reinvigorate even more fully. And we are leading the way in Canada, but there's still a ways to go, obviously. We've also, in that protection program, found one of our greatest sectors of support has been hundreds of restaurants, food service and entertainment facilities, particularly a hard-hit sector of our economy during this time. And we encourage any and all Manitobans to support all our businesses and to give their patronage as much as they can to those small businesses that are so vital to supporting the jobs we all depend on. Speaking of jobs, our support programs, our wage support programs, specifically the most generous in the country, have helped more than 22,000 Manitobans find work and get their lives back. And I would mention more than 2,000 new jobs created in the last 4 weeks, over 500 new jobs just last week. We again expect this program to continue to be subscribed to or additionally subscribed to, because as you know, we've expanded that program not once but twice in its time frame. It now goes right till the end of the year, and it also initially covered up to 5 employees, but now covers up to 20 employees. So some businesses may be using that program on an expanded level once we can make progress against COVID, and that is our number one goal. The number one responsibility we have to face up to together is public safety, and the best thing we can do to help our local businesses is keep COVID out of our local businesses and out of our communities so our businesses can operate safely and so customers can have the confidence they deserve to have that they'll be safe in those businesses doing business with those businesses. That's our goal. And so to support that goal today, we are announcing additional enforcement measures to help protect Manitobans and to help limit the spread of COVID in our communities. Aujourd'hui, nous annonçons des mesures d'application supplémentaires pour aider à protéger les Manitobans et limiter la propagation de COVID-19. The vast majority, it should be noted, of Manitobans are doing everything the doctor's orders ask them to do. And they're following the fundamentals, and that is important. And I thank Manitobans for that. That's so critical as we move forward. We are all of us, fed up with COVID, tired of COVID, frustrated by COVID. But COVID is diligent, and we must be even more diligent about COVID. And that means following the fundamentals. As winter approaches, my wife says it's the best time of year. I don't agree, but nonetheless, for many Manitobans, they will be faced with the challenges that winter brings. And some of those challenges will need to be accompanied, of course, by even more diligence as we exercise more diligently the practices that help protect ourselves and each other. Sadly, though, there is a small minority of people who are not doing their part, and they are ignoring the advice of our public health experts. They are putting their health at risk. They are putting the personal and financial health of all Manitobans at risk as well. And so, effective immediately, the new fines for those who disregard or fail to comply with public health and emergency orders are as follows. For individuals, $1,296. It was $486. And for corporations, $5,000. It was about half that much, $2,542. Over the past few weeks, in partnership with our enforcement partners and agencies, and these include the RCMP and other police agencies, public health inspectors, liquor gaming inspectors, workplace safety and health inspectors, and Manitoba conservation officers, we have targeted and increased our enforcement efforts where we have seen the problems exist. In addition, I should note that we are in the process of writing regulations, which will come into effect very soon, to support our local governments by amending current provincial regulations that enable municipal bylaw enforcement officers to enforce our public health and emergency orders as well. That would add well over 130 bylaw enforcement officials across the province. We'll continue to make every effort as well to educate the public. This has been our first focus, and our first concern was to make sure the public was aware of the measures we're taking, why we're taking them, and the dangers to them of not following these measures. And so we'll continue to make those efforts through our advertising campaigns and through other means. And we thank the media for their work in covering COVID in respect of getting the message out about what those safe practices are. Protecting each other is the job that we face. All of us have that obligation. And at the end of the day, additional enforcement measures are needed to get us back on track, to help bend the COVID curve, to help us protect each other. As Dr. Roussin mentioned last week, for example, and it bears repeating, one person with symptoms of COVID attended a social gathering at a restaurant on September the 11th. And this led to 40 COVID infections and 243 close contacts in just 12 days. That's why we've just beefed up the contact tracing capabilities by entering into a partnership with the Red Cross. And that's why we need greater measures at this time to protect all Manitobans as well. Today we're announcing some greater deterrence for those who choose to ignore the rules. It's our hope these new fines will help limit the spread of this virus. These new fines will help save lives. They will help restart our economy. They will help small businesses to get back on their feet. Some of the people who've been, and we have listened to public feedback throughout this pandemic and acted on what we've heard. And some of the people who've been calling for these additional deterrents, most loudly, are the very people who have faced this challenge, and that's the small business community. But they're asking for additional levers to make sure that they're able to keep their businesses safe, their workers safe, and their customers safe. Ces nouvel monde contribuant à limiter la propagation de ces virus, ces nouvel monde aidant à sauver des vies. It is and has been crucial, and it will continue to be even more crucial, that we follow the fundamentals, that we stay home when we are ill, that we wash our hands, practice good hygiene, cover our coughs, practice physical distancing, wear a mask, limit our gatherings, get a flu shot, download the COVID Alert app. The fight against COVID-19 is a team effort. It requires all hands on deck. And as I have said since March, this is a marathon, not a sprint. COVID is persistent. Manitobans are more persistent. COVID is determined. Manitobans are more determined. COVID apparently is resilient too, but Manitobans are more resilient. And together we will prevail, and together we will beat this thing. I welcome your questions.
Thank you, Mr. Premier. A reminder to our reporters on the line, there will be one preliminary and two follow-up questions today. Up first from the Winnipeg Sun, Scott.
Morning, Premier. Just to clarify, are you still going to be doing an education-first approach? And if so, why 8 or so months into this are we still doing education when people at this point should know what the rules are?
Well, because repetition is obviously helpful. Derek Jeter went to his last spring training, and I always remember the interview when they asked him, this is a first ballot Hall of Fame baseball player. And they asked him, what is it you're working on this spring training, Mr. Jeter, your last spring training? And he said, I'm working on the same things that I was working on when I was 8 years old. It's the fundamentals. That's what we're working on. And repeating the fundamentals is going to make us all stronger. Obviously, for some people, it's a lesson that needs to be repeated more than for others, but it needs to be repeated nonetheless.
For sure. And second, will there be a crackdown then on some of these anti-mask protests that are happening, stuff like that, where people are just openly flouting the rules?
Well, the enforcement changes that we're announcing today will beef up the number of people able to do enforcement. That'll help. And also what we hope is obviously that people get the message and are deterred by the potential for losing some coin out of pocket. That seems to be a message that some people only respond when it's their dollars that are taken away from them. If they choose to act irresponsibly, they can be prepared to pay for that irresponsibility.
Sure. And just my final question, do you have a breakdown of those 134 tickets? How many were handed out to businesses? How many were handed out to individuals?
Yeah, I think Justice will have that, Scott, and we should be able to get that to you for sure.
From CBC Manitoba, Bart.
Hi, Mr. Premier. What specific number of police officers, health inspectors, conservation and climate workers, workplace health and safe inspectors, liquor, cannabis, gaming inspectors, how many specifically will be dedicated to do enforcement on top of what's already being done right now?
I think we could get you that list, Bartley. I don't have it with me. I would just add that we have, with the amendments that, the regulations, that we're proposing to introduce, the number should be about 130 more people that will be able to do these types of things. We had requests from the mayor and others to empower our municipal governments to be able to give this specific additional responsibility to their people. So we're acting on that request.
Thank you very much for that. How do you feel about it taking as long as a week in Manitoba to begin contact tracing positive cases?
Well, I don't feel good about it at all. And as I said last week, I'm not happy with the bottlenecks in the system, but I also acknowledge that they're happening all over the world, and we're not the only ones that are having to face the challenge of improving our systems. The interesting thing, Bartley, is you've observed it, I think, is that as you solve one bottleneck problem, you create another problem further downstream. So for example, we had people waiting far too long to get tested. We've addressed that in a number of ways. Now we're getting more tests done, and the wait times are coming down, we're hearing. But now, of course, that adds to more work has to be done at the testing facility, and then there becomes a bottleneck there. That bottleneck is being addressed this week by the contract that we entered into, a tendered contract, by the way, with Red Cross to beef up our contact tracing capabilities and to strengthen that so that people don't have to wait. It concerns all of us when people are not able to get their test results back rapidly. So that's the focus of our improvements in recent hours and days.
Thank you very much for that. Mr. Premier, would you put a loved one in Parkview Place personal care home?
Well, I don't have the advantage of having parents anymore, Bartley, as you know, but obviously my concerns, my affection for seniors is pretty well known and understood. And so when I hear about Parkview and other seniors' homes having these outbreaks, it breaks my heart. That being said, and saying it's not as bad as other places doesn't make me feel any better. I know that the staff that are there are working very, very hard. I know that public health officials have been working cooperatively with them to address concerns. And I know that family members are absorbing a lot of additional responsibilities and stress right now too, and I'm totally sympathetic with that. We're doing everything we can to address these issues, and we'll continue to. These are precious, precious people to us, and their protection is of great importance to all of us.
From the Canadian Press, Steve.
Steve Lambert from the Canadian Press. Premier, do you think the government's messaging may be partly to blame for the ongoing numbers that we're seeing in Winnipeg? People are gathering. Dr. Roussin has said a lot of this is social gathering and people going out, symptomatic or not. It's clear that people are continuing to congregate with people outside their household. Is there a reason that the province has not said, just don't gather with people outside your household for the time being?
Well, Steve, this is an ongoing question, I suppose. Every aspect of how, as people in government and leadership, we're facing up to the challenge of the pandemic is open to criticism and suggestion, and I don't expect that we're going to do anything but continue to listen to the criticisms and the suggestions and act on them whenever we can. That's why, for example, in terms of the processing issues, we've added additional testing sites in the last few days, 2 in Winnipeg, 1 in Brandon. That's why we've expanded the contact tracing I just referenced. That's why we've added, with Red River's support, credentials course at Red River, so we can expand the number of people who can administer the COVID tests and address some of the concerns about backlogs at in that area. That's why we've added an online booking system to assist people in being able to more effectively save their time and hopefully assist in remedying the wait times that people have had to endure for getting tested. And that's why we've expanded the test capacity sites to doctors' clinics with the support and partnership of Doctors Manitoba. So we're going to continue to take the input, act on it, and there'll be lots of room for Monday morning quarterbacking. I expect it to be more productively done after we've got COVID under control than during it.
But in terms of messaging, is there a reason that the province has stopped short of saying, stick to your household bubble? Maybe it's mental health concerns or economic concerns or some other concerns, but the message to the general public is that, well, lounges and some other establishments are still open. You can go out and, crowds of up to 5.
Yeah. Okay, well, 2 points. One, we launched an advertising campaign which addressed some aspects of what you're talking about a few weeks ago. I remember some people were pretty harshly critical of that. We felt that was wise to do at that time, and we're continuing to do that. So advertising and getting the word out that way has been strengthened. Secondly, on the issues around confusion around the rules, we have a pretty archaic, frankly, very complex series of rules around licensed establishments for distribution of alcohol in this province, as you know, Steve. And we inherited such a system, and we're addressing that, and we've simplified it somewhat. But it remains true that it's not a simple thing to do to just shut down businesses willy-nilly in the hopes that you beat COVID that way, because that also shuts down the working opportunities and the profit opportunities, frankly, for small businesses around our province. So we're trying to do our best to get the messages out about what is safe and what is not, the safe practices that people need to follow, not in an effort to hurt businesses, but rather in an effort to help them to continue to operate safely. And most businesses have been very compliant in doing that. And I think repeating those messages, as I said earlier, is critically important as we move forward.
And in terms of enforcement, we've heard, we in the media have been notified of many fines that have been issued against a small number of businesses for allegedly breaking the rules. But we're not hearing much about individuals being fined. Is there plan to increase enforcement on individuals? Because not all of the decisions, the poor decisions being made out there, are being made by businesses.
Yeah, it's a great point. One of the things I really very strongly believe in is an individual accountability and responsibility. And so I believe you make a good point. And yes, I think by stepping up the enforcement, raising the level of fines, it is our hope to make sure that individuals who are making decisions which hurt others are held accountable for their decisions. That's exactly right. Businesses have a shared responsibility, and when people are in your business, you are responsible for making sure that they follow those public health orders. And so, yes, there's a business responsibility. But small business owners, including restaurant owners and beverage room proprietors, have told us they want to have these fines be a better deterrent to people because they think it will assist them in having a safer environment to run their business and for their customers going forward. So we're acting on that advice, knowing that it's the individual, the few number of individuals who are, as I gave that example of Dr. Roussen's earlier, that are causing the problem for so many other people who are doing their best to follow the advice that we all know we should be following.
From CTV Winnipeg, Jeff.
Well, hi, Mr. Premier. Jeff Keel, CTV Winnipeg. A lot of people are asking why you did the reversal on the beverage rooms. Was there a lot of pressure from these businesses and hotels? Why the change? And did you have to kind of get Dr. Roussin on board with that?
Well, the decision, the approach that we've taken right from the start of this pandemic was to put our plan out there, whether it was for stepping up or relaxing restrictions, and ask Manitobans what they thought. Everybody's a lobbyist if they want to be in our province because we are a listening government. We had, I think, over 35,000 Manitobans give us input on that last phase of reopening. And we changed at every step. We made some changes based on what we heard from Manitobans, and we continued to do that on Monday with lesser restrictions being imposed on some industries than were originally floated. That's a team decision. Public health obviously has the hammer. They have the last rock coming home in the last end. They get to make that call. But clearly Manitobans have a chance for input, and that's the way it should be. And the government of Manitoba, I'm accountable for those decisions. I'm happy to say that I believe the approach we've taken is a cooperative one, and I think it's an approach that works better than something else that isn't as cooperative.
But at the end of the day, I heard what you said, but this wasn't a draft plan Friday. This was a health order, which is signed by Dr. Roussin. So explain to me how Dr. Roussin then says, well, okay, it's okay to then include or to reverse this decision, because it's one thing for you to make a decision, the team, but at the end of the day, Dr. Roussin has to sign off on it, and it wasn't a draft plan you released on Friday. That was it. It was a health order.
It was a draft plan. Dr. Roussin is a draft plan, and Dr. Roussin is the person who made the final announcement and the final decision. But I'm accountable for it, and I'm happy to be. I can only tell you, Jeff, that there's no exact science on an unprecedented pandemic. Public health is trying to make their decisions and their recommendations and the rule changes that they impose based on science, but science is in its infancy on this pandemic, to put it bluntly. And so I support Dr. Roussin's decision in respect of limiting the impact of his decisions, or the parameters of his decisions in respect to certain restaurants and bars. And I think it's in keeping with the spirit we've shown throughout this entire pandemic, which is to be open to input, to listen to it. I don't see that as a bad thing. I see that as a good thing.
Thank you. My last question, on the fine amount, how did you reach those? Because the individual ones are going up more than double. The business ones, the corporations are going up double. How did you land on those amounts?
There's a team that discusses all these issues, and I think they arrived at the reality that was expressed earlier, that individuals have to be held accountable for their decisions. This isn't about just punishing. Most businesses are doing their absolute best here, but there have been some examples of irresponsible businesses, that's true. But it's the individual that needs to be accountable for their decisions, and that individual fine went up more than did the corporate fine for that reason.
From the Winnipeg Free Press, Carol.
Good morning, Premier. I'm just wondering, do you know how many licensed establishments will have to close for 2 weeks? Do you have a number of the number of places they're going to have to shut down?
15, I think, Carol, give or take. Don't hold me to that exact number, but I think it's very close to 15. And it's for 2 weeks. I should mention that unlike, say, Quebec, for example, where these, generally the restrictions have been in place now, they've just been steepened, but they were in place for the last 2 months. we're hoping these are more temporary. That's going to depend on Manitobans following the directives, and it's going to depend on us starting to flatten that COVID curve number, as you know.
Okay. And if there's only 15 that are impacted, why not provide them with some direct financial support just to get them through the 2 weeks? Because, we've heard from several that this could be life or death for them in terms of their business. This is an existential threat. And if there's not, tons of them, why not give them some direct help to get through this right now?
Well, 2 points, Carol. First of all, we have given direct help. We have approaching 10,000 businesses that have received direct help through our programs, which are the most generous in Canada. Overall, our support for small business through our wage subsidy programs, for example, has helped over 22,000 people get back to work. These programs are available to these companies. And in addition to a number of federal programs, we hope that the federal rent relief program gets some skin on the bones fairly quickly, and that also the sick leave program, which Manitoba led the way on fighting for, gets back in place sooner rather than later. Both those will help our small business community. They'll help all of us. But this is about supporting our businesses to get through a difficult time. Carol, I can only say there's not enough money in any treasury to make up the hardships and losses that have been experienced, not just by small businesses, but by people right across our country. And we're doing our very best, and I'm told overall we have the third most per capita allocations for support programs in the country of Canada, despite the fact that we inherited the greatest debt in Canada of any government. So we're doing our very best, and we'll continue to do our very best to address job one. And job one is beating COVID. Job one is getting that COVID curve back down to where we had it when more of us were listening to the fundamentals and applying them in our lives.
Okay. And finally, the healthcare workers have filed a grievance saying that they don't have adequate PPE, including at homes where outbreaks have been declared. I'm just wondering, what's the problem with people being able to access PPE on the job, especially at personal care homes where there have been outbreaks and people have died?
Carol, I can only tell you that 95% of our PPE challenges have been faced in this province by our government. We didn't get a lot of support despite early promises from the feds they'd deal with it. And for this reason, we're continuing to focus on making sure, with the help and support of mostly Manitoba businesses, that we get our PPE out there to people so that they're able to be protected in their jobs. But I would also say that this is part of our reluctance in accepting the federal government's argument that they're going to solve our problem on ready testing options and ultimately on vaccines. That's why we're acting as best we can as a government to protect the interests and health of Manitobans, not out of distrust of the federal government, but out of a genuine desire to make sure we're looking at all avenues to protect Manitobans as best as we possibly can.
From Global, Will.
Good morning, Mr. Premier. Just trying to understand the process a little bit here. If contact tracers were to find out that, for instance, I'm one of these people who went to a party or a bar, or maybe a family gathering is a better example, and subsequently dozens of people there got COVID, and I was responsible for that, could I then be fined?
Geez, I don't know. We'll have to get an answer for you, Will. I just shame on you for doing that, Will. You shouldn't do that. But I don't know, honestly, and we'll find out if there can be fines in retrospect, given if there was significant evidence. I suppose that would be possible. But I'll let our justice guys get back to you on the answer to your question.
Okay, thanks for that. So if we have a fairly large province here, I'm just wondering, can you go into a little bit more about how enforcement's going to work in some of these rural, remote, or northern areas?
Well, that's part of the strengthening through regulations aspect of this, I think. We do have uneven distribution, obviously, of presently licensed people, but by empowering the local municipal councils, it's our hope that they would then be able, where they see fit, to apply some pressure in their locales. We understand would be potentially over 100 people outside of the city of Winnipeg alone that would be empowered by the reg changes to be able to do enforcement and ticketing in rural areas. So should help. And again, we're fortunate right now in lots of areas of the province not to have a very high positivity test number, but that could change. It all depends, the future's in our hands, and it depends on our abilities to, and our willingness to listen to the recommendations of Dr. Roussin.
Okay, thanks for that. Final question, switching gears a little bit. I know we touched on this a little bit just a moment ago, but some of these businesses that have had to close and others that say they're in a very tight position right now, they are asking for new sector-specific support, and they're wondering, is any coming?
Well, at this point, we have broad sector support. We've offered support right across the spectrum of those industries that not specifically are lobbying right now, such as the restaurant industry, but for other industries as well. Nonprofits have suffered, funeral homes, any related hospitality industry or accommodation industry. Now, it's not just the food services industry. It'd be hard-pressed to find many Manitobans that haven't had a negative consequence as a result of COVID. So sector programs are not widely used across the country. I've heard some mention of the Quebec program that was introduced. Quebec has a very different and much longer in duration challenge for its small businesses than we are facing here. And our hope is by focusing on job one, which is to beat the COVID curve down, that we're addressing the number one concern most small businesses are telling us they have. And Manitobans need to feel confident going into their stores and places of business. And the best way to deal with that is to focus on public health. That's what we're announcing today.
From the Brandon Sun, Colin.
Hi, Mr. Premier. Earlier when you were talking about some of the health orders introduced in Winnipeg for restaurants and bars, you said that some of the licensing rules are archaic and haven't been dated in decades. I was just wondering what's changed in the last few decades that needs to be reflected in some new rules.
Well, Colin, all I can say is that I believe we have a kind of a Rubik's Cube wrapped up in a riddle and deposited in a maze, and the regulations are far too complex, and we've undertaken to make some improvements already. For example, we took steps to allow restaurants to be able to deliver food with their liquor with their orders that they had been prohibited from doing since time immemorial. So we've already taken some steps to assist small businesses in being able to adapt, but we're going to need to take other actions as well. Some of these discussions are already underway, and this is a problem not of recent vintage. This is a problem of long-standing in Manitoba.
On a different note, you mentioned that your government is working to amend regulations to enable municipal enforcement officers to enforce these health orders. Was this something that municipalities had been asking you for?
Yeah, I can't say that I've had specific instruction with Mayor Crest on this, but I do know Mayor Bowman had specifically raised this issue, and I have had some anecdotal reports from MLAs that other local councillors and so on in some of their areas had also said, wouldn't that be helpful? We agree, it'd be helpful. So we're taking steps to address the issue and empower local governments to be able to deal with the issue locally, and that'll support our other officials, literally hundreds of them, who are already in a position of being able to ticket and to assist in enforcement.
My last question, I know that the province recently partnered with Red River College to provide additional COVID-19 training. Will any similar programs like that be coming to Assiniboine Community College here in Brandon?
Not at this point in time. I don't think I haven't heard of a plan that's being developed in respect of that.
Our final reporter this morning from CHVN, Taylor.
Hi, good morning. Without stigmatizing, what should a person do if they believe a neighbor or someone else they know is a positive case of COVID-19, but they see them going out and about?
Well, we have a helpline you can call. We can get you that information. We have a shared responsibility, and I don't mean, you referenced the word stigmatize, but I don't think we should be shy about trying to protect ourselves, and we shouldn't be shy about trying to help other people protect themselves either. I know that, and we've done our very best to address some of the delays, for example, in testing. I know there was, I have heard reports of some folks who were so frustrated with the waits they didn't bother to get tested. They're just dealing with it. Fine, if you're isolating, that's fine. I suppose it's sad, but you're not hurting somebody else. But if you're not getting tested when you have symptoms, that's a problem. That's why we've taken steps to encourage that to happen and expanded our testing sites, expanded our contact tracing too, if you're positive, our follow-up capability if you're having to self-isolate, having come back from foreign travel, for example, something like that. Why we've taken steps to address the online booking possibility to help people. But I think in respect of your question, we're all in this together, and I would hope that we're not shy in offering encouragement and help to one another if we see a problem.
And if an individual believes they have wrongfully gotten a fine due to the COVID-19 enforcement, what can they do?
I think there's an appeal mechanism. Actually, Taylor, we'll get back to you on the appeal, but I think there is an appeal mechanism people can use if they feel they're unfairly fined.
Okay. And the fine for individuals is very specific. Can you explain a little bit more about how you got to that number?
We looked at other provinces. I think that fine will put us at the second highest level of fines in Canada. We now have the first or second highest level of COVID transmission. Our positivity ratings are coming down, but they're still high, and we're acting accordingly. We have to adapt. This is part of adaptation. We have to encourage each other. This is part of encouraging each other. We have to educate each other. This isn't part of that. This is made necessary by the fact that some people appear not to be able to learn. And despite all efforts from many, including people in the media, including government, including their friends and neighbors, some people appear unwilling to accept their personal responsibilities, and they'll be accountable for that in future because they will be paying a fine if they are spreading COVID and putting other people at risk. Thanks, everybody. Appreciate it.